Welcome and all. Today, let us have a discussion on hypoxia and oxygen therapy. Myself, Dr. Vishwanath, Hiremath, Professor Head of Department of Anesthesia, Lakshman Institute of Medical Sciences, affiliated to Bharat Institute of Higher Education, Chennai. This talk, we are going to define hypoxia, various types of hypoxia, what are the symptoms the patient present with hypoxia, management of hypoxia, oxygen therapy, various devices used to supplement the oxygen to improve the oxygen delivery, thereby maintaining the aerobic metabolism. And hazards of oxygen therapy. What is hypoxia? Hypoxia is inadequate oxygen supply to the body. In other words, a condition where there is not enough oxygen in the body tissues to maintain homeostasis. Failure of the tissue to receive adequate quantities of oxygen includes anoxia, total lack of oxygen, no oxygen at all. Hypoxia, inadequate or less oxygen. It may affect the entire body or particular region or localized. Hypoxia can be split into hypo means less oxygen. Less oxygen supply to the tissues of the body. Consequences, deficiency in either delivery or the utilization of oxygen at the tissue level results in decreased function, decreased metabolism, or even the structure of the tissue. Brain needs oxygen, and when it is not getting adequate, there will be a fatigue, air hunger, nausea, headache, dizziness, euphoria, blurred vision, numbness, and tingling. Signs of hypoxia include hyperventilation, increase the rate and depth of respiration in order to increase the draw more oxygen and supply. Cyanosis because of the deoxygenated blood. In mental confusion, lack of muscle coordination, tachycardia, tachypnea, and hyperapnea. What are the different types of hypoxias? There are 4 types: hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Hypoxic hypoxia is inadequate oxygen of the arterial blood due to breathing gas with the low CO2 at a high altitude. It can be due to hypoventilation. Okay. Diffusion hypoxia. Anemic hypoxia, insufficient amount of functional hemoglobin. So hemoglobin is less insufficient amount of functional hemoglobin. And 2, blood loss, more blood is lost. Or deficiency of nutrients, iron and vitamin B1 and B2. Stagnant hypoxia, inadequate blood flow, entire body. It can be to the entire body because of congestive heart failure or localized area arteriosclerosis. Histotoxic type is disability of the cells to use oxygen, inactivation of certain metabolic enzymes. Anemic hypoxia refers to the altered affinity of hemoglobin for oxygen, decreased amount of hemoglobin in the blood. Anemia, carbon monoxide poisoning. Carbon monoxide is 250 times. Carbon monoxide has 250 times higher affinity for hemoglobin. So, carbon monoxide combines with hemoglobin, forming carboxyhemoglobin, and fraction of hemoglobin available for oxygen transport is less. So, less oxygen bomb, so less oxygen delivery to the tissues. Mixed hemoglobin means self-hemoglobin. It can be inherited or acquired. Tetralogy of palate and acquired nitrites or sodium nitrate, cyanide poisonings. Stagnant hypoxia refers to the inadequate blood flow leading to inadequate oxygen to the tissues. General hypoperfusion due to low cardiac output, local hypoperfusion due to arterial occlusion. Histotoxic hypoxia refers to the hypoxia where the tissue cells cannot make use of the oxygen supply to them, though the amount of oxygen delivered to them is adequate. Etiology, inhibition of the oxidative phosphorylation by tissue toxicity because of bacteriotoxin. Mitochondrial injury to radiation of free radicals. Absence of vitamins like vitamin B1 and B2, coenzymes required for oxidative phosphorylation. Effects of hypoxia depends upon the degree of hypoxia and duration of hypoxia. Other factors like disease drugs will also contribute. The respiratory system, low PO2 stimulates the chemoreceptors in the carotid and aortic body, leading to increased ventilation. And low PO2 leads to pulmonary arterial constriction, even pulmonary vascular resistance, increased pulmonary vascular resistance. Cardiovascular is systemic vasodilation, a direct effect of hypoxia. Vasodilation, hypertension. Hypoxia, the peripheral chemoreceptor stimulation increases the sympathetic activity and to increase cardiac output and cerebral vasodilation. Metabolism, reduction in the aerobic metabolism. Anaerobic metabolism sets in, leading to metabolic acidosis. Central nervous system, acute hypoxia leads to headache, agitation, poor memory, inability to make judgment, loss of coordination. Chronic hypoxia, impaired concentration, fatigue, drowsiness, cerebral edema, and neuronal injury. Hepatic system, acute hypoxia is to centrilobular necrosis, chronic hypoxia, fibrosis. Renal system, acute hypoxia related to tubular necrosis, chronic hypoxia, cortical necrosis leading to the increased synthesis of erythropoietin. Post-operative hypoxia, Nunn and Pine showed after general anesthesia, arterial PO2 is lower than the normal. Factors contributing to hypoxia include diffusion hypoxia, pink effect, because of the diffusion of nitrous oxide, if at the end of the surgery, if oxygen is cut off, it can lead to the diffusion hypoxia or pink effect. Increased ventilation perfusion. Other causes of postoperative hypoxia includes increased ventilation perfusion mismatch and reduced cardiac output. Postoperative hypoxia can also be because of the drug effect, hypoventilation, anesthetic and narcotic effect, drugs, partial respiratory obstruction, pain, intraoperative hyperventilation. Oxygen therapy. Oxygen is required for the aerobic metabolism to provide biologically needed energy. Inadequate oxygen results in anaerobic metabolism, decreased energy, and acidosis. Oxygen therapy is required for impaired tissue oxygenation to allow the adequate metabolic reaction to set in to prevent complications of hypoxemia. Oxygen, though essential, it should be used as a drug. Otherwise, it will lead to oxygen toxicity. Absorptive lactasis, pulmonary complications, and cerebral complications. All Pulmonary effect, Lawrence-Smith effect. Oxygen regime delivered with a variety of devices and concentration and at different concentrations. Used therapeutically to increase the SaO2 and PaO2 by increasing the FiO, inspired oxygen concentration above 0.21, which is atmospheric available oxygen. Atmosphere contains 21% of oxygen. Oxygen therapy increases the oxygen transport by ensuring the saturation of hemoglobin by increasing the level of dissolved oxygen in the plasma. Indication: documented hypoxemia. PaO2 less than 55 ml. Acute care situation in which hypoxemia is suspected. Severe trauma, acute myocardial infarction, short-term therapy in the postoperative period. Contraindication. There are no specific contraindication when indication for oxygen therapy are considered on judgment base. Modes of oxygen delivery. Oxygen is delivered by various equipments. It can be low flow device, low flow with reservoir, high flow with enclosures. The nasal cannula, 1 to 6 liters per minute, which can provide a FiO2 of 25 to 40%. Face mask. Face mask acts as a reservoir. The flow 5 to 10 liters per minute, FiO2 can provide a FiO2 40 to 60%. Tent, face tent, 10 to 15 liters per minute, it can provide FiO2 40%. Venturi mask, fixed FiO2 providing device based on the walls. They can provide FiO2 24 to 60%. Precisely well controlled fixed FiO2 can be provided. A device with the non-rebreather flow, 22 12 to 15 liters per minute, it can provide FiO2 of 80 to 95%. High flow nasal cannula, flow of 40 to 60 liters per minute, FiO2 21 to 100%. Design versus purpose. Clinical performance is more important than the design of the equipment. Two types of device. FiO2 provided just fixed FiO2 supplementation or have variable FiO2 supplementation. Low flow FiO2 is less than by low flow devices, FiO2 provided is less than 35%. Moderate flow 35 to 60%. With the high flow up to more than 60%. Low flow, maintain low flow, FiO2 less than 35%. Moderate flow, FiO2 35 to 40%. High flow, FiO2 more than 60%. Fixed or variable depends upon how much of the patient's inspired gas system supplies. Fixed performance, stable FiO2, fixed versus variable. Fixed performance device provides stable FiO2. Variable performance, inspired gas is a mixture of delivered oxygen diluted with variable amount of room air, which is contained 21% oxygen. Room air dilutes the delivered oxygen, and FiO2 delivery varies from minute to minute and breath to breath. In low flow supplementation, oxygen delivered is always less than the patient inspired flow. Apart from the oxygen flow, remaining inspired flow comes from the atmospheric air. And this should dilute the oxygen because of the delivered air. Variable performance, the device will act as variable performance system device. Types of deliveries. What are the devices? Nasal cannula, FiO2 22 to 45%, and alternative nasal cannula, you can use nasal catheter. Estimated FiO2 nasal cannula. If you supplement 1 liter per minute, 24%, 2 liters per minute, 28%, 3 liters per minute, so on, 5 liters, maximum 40%. Patient with normal rate and depth of breathing, each liter per minute of nasal oxygen increases FiO2 by 4%. A reservoir system. The function as a fixed performance system. Reservoir must to make it as a fixed performance system. Reservoir must exceed the patient reservoir that is the reservoir of the volume. Reservoir volume should be exceeding the patient tidal volume with no air leak. Flow required 1/4 to 4 liter per minute. FiO2 range from 20 to 35%. Variable performance device. It lowers the cost because lesser oxygen is utilized in a proper way. Less discomfort to the patient. Simple face mask. Basic reservoir system. The flow requires 5 to 12 liters per minute. It can provide FiO2 35 to 40%. Flow rate must exceed 5 liters per minute to replace the exhaled gas with the fresh oxygen. Otherwise, rebreathing of carbon dioxide will occur. Flow rate must exceed 5 liters. Flow rate must exceed 5 liters per minute to replace exhaled gas with the fresh oxygen. Otherwise, rebreathing of carbon dioxide will occur. The estimated FiO2 to the face mask is when you provide 5 to 6 liters per minute is 40%. With 6 to 7 liters per minute of flow, FiO2 provided is 50%. 7 to 8 liters per minute FiO2 provided is 60%. Partial rebreathing mask. It will the mask with the reservoir bag of capacity 1 liter. Oxygen flows directly into the reservoir bag, which fills during the exhalation. Oxygen flows which fills during the exhalation. Designed to capture exhaled gases during the initial part of the exhalation. Initial part exhalation gases are captured in this and used for providing inspiration because they are not containing the carbon dioxide. Because they are coming from the anatomic dead space, which has not taken part in the gas exchange. Partial rebreathing mask provided FiO2 60 to 80%. Minimum gas flow is 8 liters per minute. Flow rate must be sufficient. The flow rate must be sufficient to keep the bag 1/3 of inflated at all times. Non-rebreathing mask provided with the one-way valve. They are provided with the one-way valve between the mask, bag, and expirator. Mask, bag, and expirator box. Reservoir bag provided with the reservoir provided with one-way valve between the mask, bag, and exhalation. Mask, bag, there is one-way valve. FiO2 of 90% can be achieved with the oxygen flow rate of 10 to 15 liters per minute. Ideally, non-rebreathing mask should not allow entrainment of air, but because of safety concern, one of the two exhalation port is not provided with the there are no, ideally non-rebreathing should not allow entrainment, but because of safety purpose, one of the two exhalation port is provided to the case of non-rebreathing. There is a one-way valve in the mask, bag, and exhalation. Expired oxygen for inspiration comes from the bag as well as the oxygen source. So on it. And expired gases will not come. Expired gases will be breathed out with this switch. It's a reservoir bag. Walls. High flow system, fixed performance system. Self-inflating bag with the oxygen inlet reservoir, self-inflating bag with the description. The flow to the reservoir should be kept high so that flow to the reservoir bag should be kept so that bag will not deflate substantially. Flow to the reservoir should be kept high so that bag will not deflate substantially. Operator must adjust the gas flow to the bag to accommodate for changes in the ventilation demand. Observe the patient and reservoir provides that information. Primary concern, aspiration, failure to maintain adequate oxygen supply in reservoir, failure to maintain constant inlet flow. Venturi mask, also known as Venturi or Venti mask, high airflow oxygen enrichment system. High airflow oxygen enrichment. To create open system with a high flow of nose and mouth with the fixed FiO2. FiO2 can vary up to 6% setting indicated in patients with the COPD. FiO2 can increase the entrainment. Yes, FiO2 can increase if the entrainment ports get obstructed by hands, bed seats, and water condensation. Venturi mask uses Bernoulli principle. Okay. Whenever Bernoulli principle. Whenever the gas flows to the constricted portion, the pressure will fall and there will be entrainment of the gases. Entrainment, driving. This is the distance when it passes through the pressure falls, so there will be entrainment of the gases. Entrainment of the gases. A plus B. There are is provide the fixed oxygen 2 liters, 4 liters per minute flow rate 2 liters per minute, 4 liters, 6 liters, 8 liters, 10 liters, and 15 liters. FiO2 provided is 24%, 28%, 32%, then 35%, 40%, and 60%. The entrainment of the room air. High flow nasal cannula. Deliver, this is a special type of the nasal cannula, which is a heated, which will provide heated and humidified oxygen via the special device. Flow rate, even for the infants, it should be 8 liters per minute. For adults, 40 liters per minute to 6 liters per minute. Patient with the, it is used for patient with the respiratory distress or respiratory problem, and it was this our COVID-19 patients with respiratory distress or respiratory failure were best managed with the high flow nasal cannula. Oxygen hoods mainly used for the young infants. Another equipment is oxygen hood mainly used will not tolerate the facial appliances or only the head, allowing the access to the lower body. While still permitting the use of the standard incubator or radiant warmer. Ideal for the relatively short-term oxygen therapy, flow rate 10 to 15 liters per minute. Then oxygen with helium, we call Helox therapy. Helium premixed with oxygen in several standard with the several standard blending of oxygen with the helium. The concentrated mixture of 80-20 or 70-30 helium and oxygen. It's used for relieving acute distress from the upper airway due to subglottic edema, foreign body, or during the management of tracheal tumors. Used as a driving gas for small volume nebulizers for bronchodilator therapy in asthma. Decrease the patient work. Advantages: decrease the patient work of breathing when Hilux is delivered via mechanical ventilator. It is less convincing in treating a lower respiratory obstruction like COPD or asthma. Hyperbaric case, another mode of oxygen therapy is hyperbaric oxygen therapy. Uses a pressurized chamber to expose the patient to the oxygen to the high oxygen tension exceeding the ambient barometric pressure. Use decompression sickness, gas embolism, gas gangrene, carbon monoxide poisoning, and treatment of certain wounds. Hazards of oxygen therapy: hypoventilation, absorption of atelectasis, pulmonary toxicity, retinopathy of prematurity, hyperbaric oxygen toxicity, and fire hazards. So, oxygen is essential, life-saving. Yes. Supplementation, but it should be used as a drug. Right dose, right way for right period of time at a right concentration. And right FiO2. FiO2 should be brought down to less than 40% within 24 hours. And the respiratory, if still oxygen is not maintained, the patient may require mechanical ventilator support. Is a patient with the severe respiratory failure due to ARDS, adult respiratory distress. So, oxygen therapy is an important topic. One should know how to use oxygen judiciously. You are welcome for clearing your doubts. If there are no questions, let us end the talk. Thank you.